Glad to have you with us today for an incredible panel on life sciences consulting. So wherever you are tuning in from, whatever walk of life you're coming in from, whatever your goals are, this panel is going to have a little bit of something for you. Whether you're a career seeker or a career switcher looking for your first or your next job inside the consulting industry, you're going to get a lot of really great insights on not only like the work itself, but a couple of really great firms and just some insights to take with you on your recruiting journey to arm you to like put your best foot forward in that. If you're a consulting firm, welcome. If you're a university kind of career services folks, welcome. Glad to have you with us today. Hope you got your notepad ready. Going to be an amazing panel, and in just a sec, we'll introduce the panelists. But while everybody's getting settled in, perhaps grabbing a warm beverage or a cold beverage if you're in a sunny place. I know most people here are maybe snowed in. Really quick, so whichever kind of stakeholder group you belong in, we've got a couple of kind of next steps that you can take here today, and just a couple of options. So if you're a candidate looking to get a job in consulting, we've got our Black Belt one-on-one coaching prep program. If you're a university career services person, all right, we've got curriculum subscriptions as well as live workshops to arm your students with the tools to navigate networking, case interview prep, etc. And then for consulting firms, we've got trainings on project management, communication, high stakes communication. We also do recruiting support as well as compensation benchmarks. So get in touch with us, scan the QR code here if it makes sense for you to kind of take the next step with us today. We work with a lot of different folks, and it's a lot of fun bringing it all together. And so for today's panel, here are the 4 consulting firms and panelists represented. I'm not going to introduce each one of them. You'll get to hear personally from them here in like 20 seconds. But I wanted to put this QR code up so that you can scan it and connect with these folks, learn more about these firms, see jobs, and just stay in touch with them. A lot of great opportunities with these firms, and you're about to hear from each one of these panelists. So just wanted to extend a warm welcome to everyone tuning in, watching, following along, as well as to the panelists today. Thanks so much for your time. All right, let's get right into it. I'm joined here by Nare Israelian, a member of our moderator team. She's going to be the expert moderator for today's panel, and how this is going to kind of flow is we'll kick off and get everybody's introduction. So you'll get to hear a little bit about them and what makes them tick and kind of why they're in consulting. Then we'll move into some questions that we've prepared that just go deeper into different facets of the life sciences consulting industry. And we'll move on to some specific audience questions that you all submitted. So thank you for submitting those. And then we're going to end with a fun closing question. And that is it for the agenda. And so I'm going to stop my share, and Nare, would love to get a quick introduction on you before we dive into the panel.
All right, thank you. Welcome, everybody. Thank you for taking time out of your day, and thank you to our moderators for taking the time to answer all the questions for everyone on the call, potential recruits, people in the industry. Really appreciate you all being here with us today. So today we have Anna, Kai-Ming, Doug, and Elsy. I appreciate all of your time, and we're going to be running through some questions. Again, I'm Nare Israelian. I am with the management consultant team. I've been with the team for coming up on 6 years now. Have been a case coach, former BCG consultant that has now taken a love for case coaching, the recruitment process, and helping candidates get their dream roles. And so hopefully this discussion today will also help candidates move closer to some of their dream roles. So without further ado, I'd like to kick it off to the panelists. And this is going to be a question for everybody. I would love if everybody could please introduce yourselves, your firm, and typically what your typical client or what your engagement looks like. And for the audience, we would also love to know if your firm is open to hiring international clients or candidates, I apologize. If we could have Anna kick us off.
Sure. Can you guys hear me? Awesome. Hi, everyone. My name is Anna Ivashko. I'm an executive with Clarkston Consulting and the commercial service lead. I've been with Clarkston for about coming up on 15 years now. And Clarkston was founded in 1991. We focus in the life sciences, consumer products, and retail industries. I specifically focus exclusively on the life sciences side. And what we do, I like to call it the implementation of strategy, process, or technologies, bringing industry expertise to our clients and kind of helping them along for the journey, as well as just developing where they want to go. On the hiring side, we hire primarily folks located in the U.S. with work authorization, although through a partner agency for our Clarkston Global arm, we do hire some international folks that have to be based in India.
Great, thank you. Kai-Ming, would you like to go next?
Yeah, Kai-Ming, one of the partners here with ClearView, been with ClearView for just over a decade or so now, based in our Boston office. ClearView, we're a life sciences strategy consulting firm. So we purely work in the life sciences with clients ranging from, the smallest biotechs through the big pharmas, investors in the space, private equity, venture capital, as well as device diagnostics sort of manufacturers. A little over 500 or so folks now. The majority of our engagements I would categorize under kind of growth strategy, and again, sort of servicing that broad range of client types. And then in terms of our hiring, we primarily hire undergraduates as well as advanced degree candidates at the analyst and consultant level, as well as senior consultant at the MBA level. And then we are open to international candidates in the US as well as then in our London and India offices as well.
Doug, would you like to go next?
Sure. Excuse me. Doug Martin. I'm practice lead at Guidehouse for the life sciences practice. We're a firm with about 18,000 employees. Predominantly 70% of our business is in public sector, so state and local government. In the health sector, CDC, NIH, choose your acronym. And then we participate in payer provider as well as pharma life sciences, so I lead life sciences. What we focus on is also growth strategy and execution. That would relate to both organic growth of products and pharmaceutical products, as well as inorganic growth drivers. This includes advisory, data and analytics, technology solutions, etc. And it includes both therapeutic areas for those of you who might have a PhD or have an MD like myself. It both includes clinical and product capabilities, as well as governance, working with other stakeholders, etc. And capability building for life sciences as opposed to just the product side.
Thank you. And last but not least, Elsy.
Thank you so much. Hi, everyone. It's a pleasure to be here. My name is Elsy. I am a principal at Roland Berger's Middle East office. I am one of the leaders of our healthcare and life sciences team, and I'm also the regional leader for all things biotech. My undergrad background is in biotech. My graduate background is in public health. So I always try to bring in that public health, population health flavor into the science and life sciences in particular. Roland Berger is a strategy consulting firm of German origin. We are present in 54 offices, around the world. In the US in particular, we have offices in Boston, Houston, Chicago, San Francisco, and this is really bad, but I'm pretty sure I'm missing one city. I'm forgetting one city. We do hire international candidates from around the world, but it's preferable to hire folks who are living in the country where the office is based, whether you are a citizen of that country or you have a work permit, or in the case of in the US, if you have H-1B visa, an L1, or you're on OPT. Now, as a strategy consulting firm, we don't only do strategy at Roland Berger. We really do. We run the entire gamut from strategy to operations to execution. within the healthcare and life sciences team, this is also the case. We work on all types of strategies, so national level strategies, transformation strategies for both public and private sector clients, focusing on government entities, on pharmacos, CDMOs, sovereign wealth funds, investment firms, family offices, and I'll get into that a little bit during the panel, etc. And what we do is growth strategy, go to market, pricing, profit and loss, value creation, venture path, etc. You name it. It's a pleasure to be here.
Thank you all. Appreciate your time. Let's dive in. And I think one of the coolest things about consulting is the impact we get to make on our clients, and knowing that a strategy that we work so hard on actually gets implemented and makes an impact in the real world. So first, I'm going to kick it off with Kai-Ming and Anna. I would like for you both to answer this question. And I would love for you both to share one example of a project you worked on that influenced a go-to-market decision, and what made that impact meaningful to you.
Do you want me to start?
Yes, please. Sure.
Perfect. So a lot of the work that I do a lot of the time is commercialization road mapping. So working with pre-commercial biotech clients that are getting ready for launch, right? And helping them think through the sequencing, the prioritization, what kind of capabilities on the people, process, technology side they need to put in place. And so as we come in and, scope the road mapping exercises, the big question we say is, how set is the commercial strategy, right? Sometimes you're 3 years out from launch, sometimes you're 18 months, hopefully by 18 months out from launch, you have really settled things. But the answer is usually overwhelmingly, we know exactly what our commercial strategy is. Let's go, we can make decisions based on that. The interesting and I feel like very impactful piece of it, as you start to peel back the onion and you start to say, okay, you're saying you want to do a co-promote. Well, what does that mean for marketing versus sales? How are those responsibilities going to be split? What you start to uncover is a difference in interpretation across leadership teams, across cross-functional leaders. So it's always fascinating for me that through enabling technology decisions and enabling process decisions, you can get folks more aligned in areas where they may not know that there's a strategy misalignment. And so that's always been really fun for me to see and help with.
Yeah. That's very cool. Is there an impact that was particularly meaningful for you that really made you almost take a step back and go, wow, the work I'm doing is making a difference?
I think the big thing on the commercial side, you start to see folks are typically pretty clear about who's going to be doing sales, but what are the marketing capabilities and who's going to drive marketing strategy and decisions sometimes is a little bit murkier. And so helping kind of push the envelope to say, well, if we decide that we want to own the marketing and own the message, we got to decide that now, because there's a suite of things that we're going to need and a suite of people we're going to need to support that. So that's been a big one.
Cool. Thank you. Kai-Ming?
Yeah, I'll share a story, about a smaller biotech that we worked with based out of Korea, actually, of all places. And so I myself, I focus mostly on what I call kind of new product planning or sort of commercial growth strategy. I don't do personally a lot of launch and commercialization work. We have others in our organization that focus on that and things like that. So my direct go-to-market experience is a little bit more limited, but we were helping this client as they were thinking about their broader growth strategy. And in terms of going to market, they were actually figuring out how do they build out a U.S. subsidiary, a U.S. organization, sort of start that. And so this was actually really one long sort of series of projects with them, where it even started from ideation, the review of their capabilities, looking at potential M&A targets for them, even kind of working up all the valuations, and ultimately helping take all of that and tell the story for public market investors, both in Korea and the U.S., thinking about how do they tell their growth story, what are the capabilities they're building out, how they actually turn this into an exit over the longer term as well, right? Translating their pipeline, their portfolio, what they were going to be bringing in terms of targets in the future, into how do you communicate the value to an interesting audience in Korea, which is primarily retail investors, and then a more biotech venture capital sort of investor set in the U.S. And then that's continued into helping them actually build out the leadership team, make executive hiring decisions, and then finally I think the company was publicly unveiled, I guess last year at some point, which is really exciting to see, right? To have gotten to be part of the sort of build out of that and see them along their journey. And then we'll see how things go with the actual drug development, right? That's the actual hard part of this. And so we'll come back to them in maybe 18 months time, see what data they have. And then hopefully it can be the point of conversation around actually getting a drug to market.
Yeah, hopefully. Fingers crossed there. Did you find this particular project different, where you're launching from Korea to the U.S. compared to other other go-to-market strategies that you worked on?
Yeah, I mean, this one was really unique in terms of the way investors in particular relate to the markets in Korea versus the U.S. are fundamentally different, and in many cases, specifically, the Korean market is actually undervalued in many ways. But we're starting to see a lot more innovation come out of Korea. So having to think through how to tell that story, to an audience, to two very different audiences was sort of a unique challenge. Whereas if you're dealing with, U.S. domicile organizations, European organizations, there's, typically a much more robust understanding of the biotech market and valuations, which makes storytelling a little easier.
Mm-hmm. Yeah, that makes sense. Thank you. Next, let's turn it over to Doug and Elsy. I would love to hear your thoughts on AI specifically. I know that's a hot topic. We're talking about it in all different types of industries, but let's hear specifically about life sciences. So I would love your opinions on how AI is shaping life sciences now in 2026. And in your work, where do you find AI actually having the most meaningful impact? And how is that changing the way your clients even make decisions?
Elsy, is it okay if I go first?
Yes, please go ahead.
Okay. Yeah, so I would say that saying how AI is being adopted by the industry is like asking how the internet affected the industry. It's so ubiquitous in all of our lives that it's in every part of the process. And I think the pace at which it is moving forward is really unprecedented. When it first started, I used to, because I'm old enough where I can remember that a cheat code for me when I was an early consultant was using Google. And I even got feedback from my first managers saying, hey, you should use the research librarian. And I said, well, why would I do that when I can just use a search engine? And so my first uses and our first uses of AI and a lot of clients was just kind of augmented search, answering questions, et cetera, and kind of poking around with it. And so I would say doing things 10 times or 10% more efficiently and learning the craft. More recently, in the last couple months, it's actually accelerated to a pretty startling degree in terms of the types of, I'm not going to call it thinking, but the kinds of analysis it can do, the first drafts, the degree to which hallucinations have really come down in the last couple of, we use Copilot and we use ChatGPT professional versions. And I would say that it is putting a significant premium on judgment, emotional intelligence, relationships, because processing speed is becoming a little bit more of a commodity. And so I would say that that's a really important component of it. And that's therefore showing up in every element of what we do. In terms of our clients, one of the projects we did recently, which was kind of interesting to me because I used to do quite a bit of valuation work and quite a bit of pipeline prioritization and new product planning and that sort of thing. And so there are these things that you do like opportunity assessments, where you're talking about epidemiology, segmentation, treatment by segment, unmet needs, competitive landscape, pricing, and you come up with the opportunity for a product. We've been working with clients who, of course, have enormous amounts of past work in their data lakes and past transcripts. And we've been developing tools whereby they can come up with target product profiles, they can come up with initial forecasts, et cetera, all using these assisted components as opposed to using primary market research. It does actually a kind of a scarily accurate view of product forecasts relative, better than Wall Street analysts and as good as as bespoke research that we might have done. And so I would say that, it's something very transformational, and it's really important for each of you to get to not be stuck in the mud about this. You're going to have to get your hands dirty and be familiar, get comfortable being uncomfortable. Sorry, Elsy, I'll pass it to you.
No worries, Doug. That was I was enthralled. So thank you. So for me, in the GCC, the Gulf Cooperation Council countries, I mostly focus on the United Arab Emirates, UAE, so Dubai, Abu Dhabi, mainly, KSA, so Saudi Arabia, and Qatar, where AI, like you said, it's the word du jour. It's in everything from the most basic recipes to life sciences, of course. Now, the GCC is uniquely positioned because several countries are building national scale programs that are AI enabled. Some of these programs a big focus for these programs is genomic and health data sets that AI can actually learn from. And this will then help lead to precision health, not just precision medicine, at population scale. So we're talking about genomics plus clinical data, and then we have actionable stratification, we have risk assessment, population segmentation, and then AI-enabled and big data-enabled interventions. In the UAE, for example, the Emirati Genome Program at a population level has sequenced 802,000 genomes, including those of approximately 702,000 Emirati genomes. This is in a population of 10 million of Emirati plus non-Emirati. And this model is exclusively about combining genomics with AI and then broader health data to drive research and partnerships. And a key word here is partnerships. And I'll dive into that a little bit later. In Saudi, the Saudi Genome Program has examined around 61,000 samples, and it's documented around 7,500 disease-causing variants, including 3,000 variants associated with around 1,200 rare hereditary diseases. Now, in the region, we do have a high incidence of what globally are known as rare diseases, mostly because of consanguinity, but also it's the genetic makeup. And so it's an amazing field for research, for anthropology, for medicine, for clinical trials, because you have access to this amazing slew of diseases and rare conditions that globally you might not have as much access to. I digress a little bit. So how does this help change or address decisions? So clients in the GCC, both governmental, pharmaceutical, sovereign wealth funds, etc., are moving from these big strategy statements to decisions that are increasingly evidence-led. So which patient or trial subject cohorts to target first, which screening pathways to scale, where to place national reference labs, what partnerships to establish, what companies to incentivize to come in and set up shop versus merge with versus acquire, and then which of these partnerships are worth the data access and the benefit trade-off. So we're looking at pharma, at CDMOs, at payers, at providers, at research centers, etc. Now, another point, or let's say another advantage of AI that's driving client decisions that we see is within real-world data and operations. A big point of AI, of course, is to have faster, cheaper cycles of research, of data generation, of decision-making, with the efficiency and, of course, the oversight and safety. So I would call this a quiet win area, and this is how AI is helping organizations, particularly CDMOs, pharmacos, and then some organizations that are a little bit of both, and how to improve their organization. So how to improve how they detect signals, how they manage quality, and then how they run supply chains and manufacturing, especially as the region is pushing for localization and resilience. So self-sufficiency and less dependency on international imports and on international supply chains. For example, in the UAE, initiatives like M42. So M42 is the combination of Mubadala, which is the main sovereign wealth fund, with G42, which is kind of like a venture capital, AI investor, innovator, incubator, etc. It's a jack of all trades organization. So initiatives like M42's partnerships to advance AI-enabled care signal how quickly platforms are being industrialized. And then the kind of the compute backbone matters. So there's major AI infrastructures in the UAE that are explicitly being designed to bring large-scale capacity online just this year. And there's a lot of investment. I'm sure you've read about the over $1 trillion commitment from the UAE in the US to be able to do some tech transfer and capability buildup in the area of AI and technology. So at this point, leaders are no longer asking, should we do AI? It's asking, it's like, what use cases are going to move the needle more quickly? So rather than years from now, it's months from now. Again, what do we buy versus build versus who do we partner with? And then what data do we need to govern like an asset? And then within that, what are we willing to share? And that's it for me.
No, thank you. No, that was it's incredible to hear about the advancements AI is helping and also just pushing the needle, moving life sciences forward. And, as you and Doug both mentioned, as AI is moving so fast, we have to get comfortable being uncomfortable for a second. We do have to evolve with it. We have to learn how to use this technology because it is here. It's moving very quickly. And so I would guess from everybody, from the moderators, for candidates who are looking to get into the consulting space in general, get comfortable with AI, get comfortable using it. But of course, given that it is doing all of this, work that, like Doug said, they used to have a research library, then it's Google, now it's AI. As this is becoming more commoditized, how do you differentiate yourself? How do you answer those critical questions? What data to find? How do you work with that data? And how do you elevate from simply finding information to synthesizing it and adding value as a consultancy and as an individual yourself, apart from just doing the research? So it's really fascinating to hear. And, I can imagine, if we did this panel a year from now, there would be even wilder, use cases and technologies and innovations that we're hearing of.
Yeah, I'll be an AI bot in a year time. So the panel.
All right, we'll look out. We'll look out for the tin arm. Let's switch it over to a slightly different side. We've talked about integrating technology into the space. Now let's just talk about in general. Elsy and Kai-Ming, I'd love to hear from you both. Just in general about the challenges of taking complex science and turning it into an applied strategy. There is a mix of life science and business involved with life sciences consulting. So I would love to hear, how do you translate that? And can you share a moment that when that transition really mattered for a client?
I'm happy to go first on this. Yeah, I mean, this is definitely, I think, one of the hardest parts of the job. And, I think for me, when I think about, my personal background and then a lot of the individuals that, we bring into the organization, you sort of think about like recovering scientists in many ways. And that comes with both positive and negatives, right? Where, the positives, you have the really deep understanding of the science. The negatives is, I think your head's always spinning, trying to get the, a little bit more deep, a little bit more precision, a little bit more data. And it can be challenging to really kind of take a step back. But, I think that's often though what clients really value is being able to bring the deep understanding, have the conversation at 3 or 4 different levels, and then ultimately help them translate that into something impactful. And I'll give an example. Actually, even today I was sitting in a workshop with a client team, and we're talking about the mechanism of this drug, and there's 2 potential uses for it, and really trying to unpack like, well, hold on, like one of these uses really like doesn't make sense on face value, even though the data says it works. If you were to ask, any group of immunologists to be like, well, no, that doesn't really make sense. The disease doesn't really seem related to the mechanism. And so, we spent 3 hours this afternoon really trying to think through is like, okay, what's the right message in the data that we can actually bring to highly scientific clinicians to actually get them to understand the value of this drug, get them to look beyond just their initial reaction. And then, what does our client actually have to do to sit there and build the evidence to support that over the long term. And can't say exactly what that is yet, but hopefully in like 6 to 12 months time, we'll actually see that message out in the marketplace and see that, which will be really exciting. And then a lot of it is also, we get to work with a lot of teams which themselves are incredibly sharp, incredibly deep, but one of the big things is how do they elevate their communication and bring that to their senior leaders, and helping them in many ways just distill down the crisp message, the short 1 or 2 sentences, for leaders who often don't have the time to really spend deep in the weeds. So the translation really matters. It's something that we think a lot about, both in our day-to-day and our training and all of that. And I think it's really important for all of those on the line to don't undervalue sort of the background that you bring to organizations like ours and our clients.
Yeah, it seems like you're constantly translating because audience matters, right? If you're talking to scientists, how do you translate the business to science? And if you're speaking to people more on the business side of things, how do you translate the science to business to make sure that the audience resonates with what you're saying and the impact matters? Just a follow up to that, and I'm sure there's candidates on the line right now that might have a life sciences background that are looking to get into life sciences consulting. Should they get a business background? People who are on maybe more of the business side, do they need life sciences acumen? How much should they have developed before coming to the firm? I think they would all love to hear, what type of preparation would be important, what type of background, really would benefit them in this type of environment.
Yeah, I mean, I can certainly speak for ClearView here. We like to see, for those that have, a undergraduate or PhD, master's, whatever it is, in the life sciences, we want to see some demonstrated interest outside of just, bench research, right? And that can come through either participation in clubs or even, through the interview process, just being able to talk about the industry, what you're seeing, things that are interested to you. But you don't need to have done an internship, at a consulting firm or, have an MBA. For us, the philosophy is we can take people that have the scientific depth and we can teach you the business side over time. And then for those that have more of a business background, for us, by no means is that fundamentally disqualifying, but you do need to have a degree of comfort reading scientific papers, sort of taking those, translating them, and being able to get sort of deeper on them. And maybe AI helps with that as well in the future and getting up the learning curve. But it's like having the comfort to be able to sort of speak fluently in that area, even if it's not your fundamental or sort of the core area you've studied over time.
Yeah, that makes sense. Just make sure you can put a good foot forward so that when you can come, I'm sure there's a lot of training and a lot of investment in everybody who joins the firm, but how do you put yourself in the best position to run as fast as you can, as soon as you can?
Absolutely.
Yeah. And Elsy, would you like to go next?
Sure, thank you. I just wanted to kind of jump in on that and make a comment before I follow. And what's important about having this knowledge and this background, not everybody needs to have a PhD in a life sciences topic to be able to succeed in life sciences consulting. But as we see more and more use of AI in our work, we need to also have that knowledge and that expertise in the background to be able to accurately guide the AI and be able to tell when the information we're getting and the way it's being presented is accurate and factual and can lead to evidence-based decision making. If you don't have that knowledge, that core research background, I still try to do research the old, not the old way, the original way, through the databases, through PubMed, etc.
The old-fashioned way, just internet.
I mean, I have a research background, so for me, it's sacred. You don't touch PubMed and the databases. And there's something that they have that, that gives me comfort that then I can guide the AI tools better. So that was my 2 cents on that. Okay, so how do we translate complex science into applied strategy? I'll talk about an example, a very current example, a project that I'm leading right now and that it's always sticking with me, I'm working with a very large GCC life sciences player who's excited about becoming a local pioneer in multi-omics, and then the near future and kind of medium futures to become a regional leader in precision medicine and eventually a global champion in precision health through the use of multi-omics. Now, the part of this is my client wanting to invest aggressively and very fast. Because again, in the GCC, you don't have this wealth of decades and centuries of knowledge that we often see in some Western countries. What we have here is really the push, the hunger, the ambition, and the government and financial backing to kind of leapfrog and be able to achieve those scientific advancements and that development in country. Now, the science conversation is moving, or was moving, I guess, because I've been with them now for several months, at like 200 kilometers per hour. So they're talking about, okay, we're going to be a leader in multi-omics and cell and gene therapies, CGT, rare disease treatment, AI-enabled interpretation, and new medicines, kind of the promise of next gen and new medicines, new therapies. But the strategic question that we had to answer very simply from the beginning with them is, what do we fund first and what do we not fund yet? And so what made this translation important and matter was that we had to turn this scientific ambition, working directly not just with the CFO and the CEO of this company, but also with the chief genetics officer and the chief medical officer. And how do we turn the strategic and scientific ambition into decision-grade choices? What's the strategic direction you're going to follow? Who are you going to partner with? What are you going to fund now for success? So we anchored the strategy, or we've anchored the strategy on what this country and this player can do uniquely well, which is population genomics at scale, and then the clinical pathways where that evidence can move fastest. So that's screening, monitoring, diagnostics, and eventual prevention, of course. So we've separated the science that's true from the science that's actionable now, because again, we need to prioritize. We can't do everything all at once. And we built a phased roadmap for the strategic direction for some of the things I mentioned before, like CGT, multi-omics, new medicines, etc., based on data and clinical utility, eventually reimbursement and pathway integration, and then partnerships for future drug discovery and trials. So being a bit more proactive rather than reactive to whatever diseases and treatments need to be addressed. Instead of course, all of this, instead of just trying to jump straight into the most capital-intensive end game. It's a slow burn, and this is what I have to tell my client, especially our chief genetics officer, is like, it's a slow burn. So the punchline is that this translation that we're trying to do, I'd say avoids a common trap. So yes, we want to build a science showcase, but we want to make sure that this science showcase that we build doesn't still converts into patient impact, into population well-being, into adoption, into sustainable business models. And so we want to make sure that through this advisory support that we're providing, our client can walk away with strategic directions and strategies that they can defend to a board and to regulators up top that fund them, and make sure that they know what's going to get scaled, what's going to stay at a pilot stage for now, what requires partners, and what needs governance before it even start touching patient care.
Yeah, that all makes sense. Thank you. I mean, of course, we would like to do everything all the time, all at once, but then that's almost running a faucet at full speed. It overwhelms everything, and there's no targeted direction, no impact. And, as consultants, I think our famous phrase is 80-20. So, and don't boil the ocean, which feels exactly what you are doing for the client here with this prioritization of impact when it comes to these different initiatives. So thank you both for that answer. And, I know, Anna and Doug, we did touch upon a little bit of the background with the previous question, but I would love for you both to answer when it comes to hiring candidates for life sciences consulting today. What is one thing they should do to really stand out as a candidate, especially among a sea of everything going on? What can they really do to get your attention?
Mine's quick. I'll piggyback on what Elsy and Kai have been saying about translation. Like the ability to translate across functions is key. So just being able to show that you might be coming in as an industry or functional expert, but you understand how some of the clinical roadblocks that we've seen can translate to commercial strategy, or can, some of our commercial demand can impact the decisions we make on the supply side and within our supply chain. And that some of that takes just energy and willingness to continue to learn, continue to be a little bit curious at areas that are kind of just pushed a little bit outside of your purview. And so whenever somebody can have a compelling story about naturally doing that, I know that they'll be successful in role.
So that would be whenever you are interviewing candidates, or maybe in their cover letter or networking conversations, being able to demonstrate that ability.
Yeah, exactly. Just being curious, being a learner, and being proactive are my three things.
Okay. Perfect. Thank you. Doug?
Yeah, I would say this became a little more personal a couple of years ago because I've got some kids who just finished university, and I realized how hard it is to find a job out of college. It made me much more compassionate with interns, etc., than I tried to be, but I didn't. I looked at it more from the sales side of the equation versus the consumers or the choosing side of the equation. So what I was going to say is I don't think there's there's nothing that's going to make you stick out from a crowd. The challenges right now are that resumes are being screened by AIs, like the number of non-human, not to get back to the AI, et cetera, but the number of hurdles to being noticed is unprecedented, and the number of slots is probably a little lighter than in past cycles. And so I think it's about doing the right things continually. Like, good process yields good results. That would include good communication hygiene. You'd be surprised what people do when they reach out on LinkedIn or an email. They ghost us. Sometimes there are some pretty incredible things that people do by accident and demonstrate that they're not ready for prime time. There's the demonstrated interest, as Kai had said earlier. Like, you do have to stick out in you have to qualify yourself as something that is sufficient, not necessarily optimal, but sufficient to get through those hoops. So yes, having a demonstrated interest, having been in clubs, sticking out just like you would in any other thing if it was grad school, etc. Extracurriculars matter, how you sell yourself matters, etc. In terms of the specifics, once you're in front and you've got a conversation, I do think it's a shots on goal effort. So I do think you should be pursuing, reaching out to people, shooting your shot, trying to get informational interviews, etc. Using your school alumni network, etc. Those are all blocking and tackling, but it's a time-proven thing, and just get up and dust yourself off if and don't be too proud if you're on LinkedIn, slam in the connect thing and only 10% respond and 1% happen to reach out. I have a rule that once in a while I answer, and it's almost indiscriminate as long as they're qualifying. So I do think that it's a shots on goal thing. And then in terms of the intrinsic that I always look for, there are three things that I don't want to have to change in somebody. I don't want to make them less annoying, less collaborative, less teach them common sense. So I'd call that the EQ group. I don't want them to be or inflexible. I can't teach processing speed if they're coming in with an IQ of whatever. I can't genetically mutate that in today's day and age. So they have to have enough problem solving to be able to do that. And surprisingly, I cannot teach or train ambition, grit, and drive. So those are my three things that I look at: IQ, EQ, drive. If you got two of those three things, you can find a profession out there. If you're really good at EQ and drive, you may make a ton of money in marketing, and you might be really, maybe you're not school smart, big deal. But we're going to look for some degree of minimally acceptable profile along those three dimensions. And those are the kinds of things I look at. It's almost like a Venn diagram. And if you can find all three to the best of your abilities during the interview process, then you make an offer.
No, great. Well, thank you. And I mean, it seems like for you, it's almost because we live in such an information influx stage with AI and all of these non-human screeners, that human component is incredibly more important. Connecting, reaching out on LinkedIn, trying to have these conversations. When you have these conversations, coming across as more of a human being and adding that EQ component to it, apart from just the IQ, especially with the processing speed of AI and such coming. So you almost think that, of course, baseline fundamentals, everything has to be sound. You have to be qualified. But to really stand out, it's that human component in the age of robotic hurdles, in a way.
Yeah, I think that's right. I think that I like to say in some ways, and I said this earlier even in this conversation, but processing is going to become a commodity. The user, as one of the other panelists suggested, still needs to guide the process. You still need to ask the right questions. You still need to have the context of what the client is trying to do. You still have the context of the drug or the mechanism or the body part, the physiology, pathophysiology. So you're going to need those things. What is human is the relationship, is the judgment, it is the application of those facts. You could have an IQ of 200 and it'd be functionally useless. And that might be some of your advisors, if you're doing a PhD right now, that are absolutely brilliant and would be useless in a business setting. They found their secret place to be, but that's not going to be consulting. You do have to have a little bit of everything and be sufficient in all those areas.
Thank you. I know we're getting close to the top of the hour, but this is a free-for-all. We have some audience questions. We did touch upon a few of them, but I think one great one is if you could share one thing you found rewarding about working at the intersection of science and strategy. And if you can make it personal, I think it would be better for everyone in the crowd and myself.
I mean, the joke that I always make is every day I'm 17 people away from saving lives. And that is kind of like an overstatement. But there's something, I work a lot in the rare disease space. There's something, to Elsie's point, right? There's some of these endemic populations with these horrible diseases that these companies are trying to help and fix and move the needle on. And even if I'm a tiny part of that every day, helping push somebody else forward, like that's incredibly rewarding to me.
Yeah. Yeah, that's incredible. I mean, I got chills, and it is impactful work. Does anyone else want to share? This is a free-for-all question.
I can jump in here if it's okay. For me, it's a little bit more selfish because I have a science background. You know, I don't come from the let's say originally typical finance MBA consulting background. So I'm selfishly very happy that I get to do something that's considered novel, especially here in the GCC, in the Arab region for consulting, which is bringing in the science. And that just, I get excited. You know, I've been in consulting for 7 years. Before that, I was with the World Health Organization. So it was, a lot of kind of theory, strategy work, different type of strategy, and lab work. You know, I was in the lab. So being able to bring a little bit of that here makes me feel like I haven't completely lost myself to the corporate world, and I like to not have to be a finance whiz and doing Excel like crazy, and still doing impact that matters.
And on that point, I'd love to turn it over to another question. If you are coming from a science background, whether, you have a PhD, a specific specialization, or you are coming from industry specifically, right? Scientific, clinical industry, and you want to break into consulting without prior consulting experience, do you have any advice, or have you seen successful candidates do one thing in particular to either stand out or be able to break in?
I mean, I'm happy to go on this, and I'll probably echo a lot of what Doug said, right? Like it's really hard to stand out on the basis of a resume, and I'll be like, I think probably all of us are very heavily involved in recruiting. Like the ability to look at somebody's resume and actually predict their success in consulting is, I don't know if it's zero, but it's probably quite low. And where you really get a sense for somebody's capabilities and what their potential is like actually getting to talk with them and getting, through the interview process itself. And so, I wouldn't necessarily guide and say you have to do X, Y, and Z. Your resume has to do this. Like prepare for the interviews, practice how to do cases, figure out what the interview is going to do, like all of those things. But this goes very much for us as consultants and our clients. Like people hire who they want to work with, right? That they want to be around, and that's what you have to show in the interview setting, right? That you are somebody that is going to be a genuinely good person to work with. You have the horsepower and the capability, the ambition to learn and to be flexible. And that's that, right? I mean, consulting like is one of the great careers out there because you don't really need a lot of prior experience to actually do this, right? I was going to go to medical school. I was like, no, I'll take a little bit of time off, and like ended up here, and here I am 10 years later, right? It's not a path that is as clear cut. So I think it's really prepare for the interviews, but then just be like a good person, right? And in a good conversationalist in the interviews.
Following off of that, I guess I have another question. What would you say is more rewarding about consulting than maybe going into industry?
I think everybody would say that it's the variety. I think we all, I think we've done a much better job than when I was first in consulting. There used to be kind of a tendency to talk about your clients and complain about your clients. And I think there's been a meaningful improvement in that area. They don't just pay the bills. They've become a lot more sophisticated. They've become a lot more available. Keeping in front of them is a humility check because the substrate of people doing it is just fundamentally different than 15 years ago. It used to be that we worked harder, we had better pedigrees, so to speak, and that's just not the case anymore. We've got really, really talented people choosing that path. I think it's an awesome, for people like the folks on the line, the diversity. I mean, it's just a lifelong learning thing. You just continually learn. The thing that I would say related to your first question, the thing that makes it satisfying and selfishly satisfying is I did an internal medicine residency, and I'm pretty sure I could beat anybody in any internal medicine residency program in terms of up to speed knowledge of clinical diseases. I've had PhDs, I've had MBAs, I've had undergrads who still know more about cutting edge medicines than I did as a doctor when I left. And so I get to study basically all day, read this stuff, learn it, put it in a context that matters to me, and get paid for doing that. And I don't have to waste my time seeing patients. No, I'm kidding. But I think, but it is really, from an intellectual fulfillment side, huge. I think from doing the right thing side, I don't preach that part of it. I don't think what we're doing is any more important or less important than any other for capitals, for profit endeavor. It is not God's work. It is interesting work that I love doing, and my moral quotient needs to be served, doing something else.
Yeah, of course. And just thank you so much for that. And since we are coming to the top of the hour and I want to be respectful of everyone's time, let's close it off. And I'd love to hear from everyone for this question. What is one final piece of advice you'd like to leave us all for any candidates considering a career in life sciences consulting?
I mean, I guess I'll say, know why you're interested in doing this. This profession has incredible reach. It's really cognitively interesting, but it's not, and my peers can share too, like, it's not incredibly glamorous a lot of the time. It's a lot about like rolling up your sleeves and making somebody else look good, or at least it is at Clarkston, and like, know why you're going into it, because that's going to be the fabric of what it's like.
I'll say, I think this echoes some of the themes from earlier. We live in a world where information is heavily commoditized, right? The ability to learn something incredibly quickly is there, and so that's not what's really going to finding information necessarily is not what's going to differentiate people. I would say the ability to tell a story with conviction, engage with another human is going to be the key thing. And of course, you need that baseline level, but you know, don't focus on like the foundational knowledge base. Focus on your ability to you know, apply the concepts, generalize them, and have a thoughtful and thought-provoking conversation.
Yeah, I agree with what's just been said on both of the points. Just to add to that, I would just say, you know, I think a lot of my career has been, or a lot of my decisions in life were made a compromise between pragmatism, anxiety, fear, and ambition. And it's kind of like, what's the safest option or whatever. And even in some of the stuff I've done in my consulting career, I think I angled a little bit too much about worrying about certain things. Worrying is a wasted thing. What I would do is turn that into action and say, what are the things, why are you worried? Is it an anxiety disorder? Is it a temperament thing? Or is there something that is sitting at that you feel you need to work on? And then solve for that. So what I mean by that is future-proof your career. We know right now, so when I went into it, there was huge opportunity for that interaction between clinical, scientific, and commercial. It's actually a fairly populated area. Right now, if I were going into it, I'd probably think a lot about the value of medicine, how we can sustain pricing in the United States, which is an irrational pricing, you know, environment. How are we going to solve for that? That's probably a really important area. So if I were going into it, I might be a market access consultant, even though I found it very boring and tedious 15 years ago when it was more kind of reimbursement pathways and it wasn't as complex as it is today. So think about what's coming and focus on that. You know, both the skill sets with AI, et cetera, as well as the domains.
Thank you. And Elsy, do you want to take us home?
Sure. Yeah, my thing is just have, you know, you can be super well prepared, or I hope you are very well prepared from a, you know, a technical perspective, but also from an endurance perspective. And I recommend that you have patience. I think the consulting market globally, and especially here in the GCC, is undergoing some, you know, very deep systemic change with the advent of AI, with, you know, changing global economies, with diversified, or I guess a divestment from certain type of capital spend and advisory work. So you need to have patience and endurance to get in, but also once you're in, maintain that stamina and that endurance, because, you know, in all honesty, sometimes this does feel like a thankless job. You know, as we've said, you're often there to make someone look good. You're often there to guide decisions, but really not getting any of the recognition or accolades for when those decisions are followed and render success. So just have that patience, be prepared, have that endurance, and again, not to be negative, it is sometimes thankless, but it is oftentimes rewarding. And my last piece of advice would be is to know exactly, I want to echo what my colleagues are saying, know why you're doing this. If it's, hey, if you want to make, you know, good money, save some money when you're young, own it. That's totally fine. If you want to do it to make an impact, then chase the clients and the projects that will help you make an impact that matters. Know that sometimes you might be asked to advise someone you might think that historically was a bad guy. Again, I have a public health background. I would have never believed you that I'd be advising pharma, but now I understand the industry so much more, so I understand why I need to be part of it. So just know why you're doing this, stand your ground, have some patience and perseverance, and just be prepared. And I need to follow this advice, be concise. So important in our communications. Thank you.
All right, thank you all. That seems like great career advice overall, whether it is life sciences consulting specific, your career journey in any regards. So thank you all for that sage advice, and thank you all for the hour, such thoughtful and detailed answers to the questions. I appreciate all of your time, and thank you all for engaging with us.
Thank you.
Thank you. It's our pleasure.
Amazing.
My pleasure.
Thanks, everybody. Well done. It's very interesting, insightful conversation here. Thoroughly enjoyed listening in, and hope everybody got a lot out of that. I'm going to leave this QR code up here for just 10 more seconds before we say adios. But again, massive thank you, Anna, Kai-Ming, Doug, and Elsy for a spicy conversation there. And I love the quote that every day I'm 17 people away from saving lives from Anna. So I'll just end the panel on that note. Thanks everybody on YouTube for tuning in. Make sure to subscribe to the channel for more of these great industry conversations, and we'll make sure you get a copy of the recording. Thanks all.